Anxiety and Depression Association of America. And you can learn more about ADAA by going to the website, adaa.org. And the presentation today is going to be on OCD, COVID, and returning to life. And I'm going to let the presentation speak for itself because I'm really excited to share our wonderful presenter and have some really helpful conversations about tips to get through this challenging time that we are all experiencing. And we're lucky to have with us today Dr. Elizabeth McInvale, and she was diagnosed with OCD at age 12, underwent inpatient, outpatient therapy, and eventually achieved success in her personal journey. Making a difference in the lives of those with OCD has become Elizabeth's life goal. And her current activities are as director of the McLean Houston OCD program, which is one of the leading OCD treatment centers in the world, and the creator of the OCDchallenge.org, a self-help website, and the founder of the Peace of Mind Foundation, a nonprofit dedicated to improving access to care and treatment for OCD. She's also a board member for the IOCDF, the International OCD Foundation, and was the first ever national spokesperson for IOCDF. So we, once again, at the Anxiety Depression Association of America are really honored to have her share with us some of her thoughts on managing these difficult times. And my name is Dr. Deborah Kissen. I am the co-chair of ADAA's Public Education Committee and also the CEO and clinical director of the Light on Anxiety Treatment Center in Chicago. And just a little bit more of some of the resources that you'll find through the ADAA website. There's a wonderful Find a Therapist resource where you could find local providers who can help you, whether it's short-term treatment or long-term treatment for anxiety and related disorders. It's always helpful to have someone on the sidelines to be of assistance. And there's also a free anxiety peer-to-peer support group as well. So feel free to check out those resources. And now I'm going to pass on the presentation to Elizabeth so she can share with us some of the information today.
I made this putty. Please just look for a second while we can read for an hour. Mama?
Okay, there's a little background, but that's just everyday life that we all have today, but we're looking forward to hearing your tips on managing all this.
Perfect. Thank you so much. And thank you, Dr. Kissen, for having me and for ADAA for hosting these webinars. They've been incredible. And we've really been able to join from afar through teletherapy and through this virtual option to learn more about how to treat OCD, anxiety, depression, and related disorders. I know early on when we were talking and just COVID was just starting, Dr. Grayson came on and did a webinar for you guys and really talked, this is John Grayson, and spoke a lot about how to do exposures and how to do ERP during this time and throughout COVID. And, you know, it was a wonderful presentation, and I think a lot of us really learned from it, as we always learn from Dr. Grayson and so many others. And it's been quite a journey since then of really starting to implement ERP during COVID, but also starting to see what it's like when this is the new norm for everybody, and anxiety is at an all-time high across the globe, but in particular, what it's like for individuals with OCD as they really start to imagine returning to life as they know it. That doesn't mean any of us are returning to normal life, right? Many times we're now returning to life with masks and hand sanitizer and all these different things, but for someone with OCD, that can really increase their anxiety, and it also can be counter to what they've always learned or have done in treatment. And so that's really what today's about. It's about what will it be like for individuals with OCD when they're returning to the new norm or to normal life. And really, how will that impact them differently than those without OCD? And I think my biggest takeaway I want to make sure we touch on today is what it's going to be like when COVID goes away, which hopefully is soon, or, you know, maybe it's a long time, but when it does, right? Or it's not front of mind and what we're talking about all the time. When individuals without OCD or anxiety are able to kind of return to normalcy without thinking too much about it or without it really impacting their daily life, how often we're going to find that being very different for people with OCD and anxiety, especially if it was centered around COVID. COVID might go away, but the OCD fears won't. And this could become a new obsession. It could take on lots of forms of contamination rituals that may stay well past COVID being here in the US or in the world. So that's really what we're going to focus a lot on today.
And just a thought as we're starting to talk about this topic, and something I've noticed it with my wonderful clients that I'm working with, there's been a certain amount of empowerment in some ways. I think they've just really, I've seen coping skills and they've been able to handle things, and really it's sort of like they've been training for this, like, yep, okay, life is uncertain, and yep, sometimes we have to touch things even if we don't know for sure it's safe. So I think in some ways it's the rest of the world it doesn't feel like, okay, I'm the only one thinking this way. And yes, there's been something somewhat empowering I've seen in the clients that I've worked with. So it's been interesting, to put it mildly, I think, for all of us.
And I couldn't agree more. And I think that, you know, I think we've seen some patients be drastically impacted by COVID. And we've seen a lot of mental health symptoms really increased by COVID. But then, as you mentioned, Dr. Kissen, we've also seen this amazing resilience and ability for the world to actually learn from OCD patients. Because the reality is that if we've done our work and we've done our treatment, we've learned the skills and the tools to live with uncertainty for a long time. And it's been quite amazing to watch that happen. I had a quote that I posted recently that I think kind of captures this, which is that OCD patients are resilient. We've seen patients who are far along in their treatment during this time be able to manage really well and actually teach others how to live with uncertainty and anxiety. And you're right, couldn't agree more. It's been really inspiring to watch.
And in fact, most of the recent clients that I've seen over the last few months are really individuals who I never consider myself anxious, and I'm having the hardest time managing this. So in some ways, not to be so half full, but there's something about working that muscle and having to have practice facing things even when they feel really uncomfortable, which Absolutely. We all have to do. So
absolutely, you know, and I think that is really something that we're seeing, is that a lot of people who are really distressed by COVID-19 and by the anxiety and uncertainty may also have not yet learned any tools on how to deal with anxiety and uncertainty, because those of us who have, and that this is a skill that isn't new to us, we, as you said, like that muscle is a lot easier to work than a brand new one to build. So so really what we're talking about is that anxiety is not new. You know, we know that about 18% of people live with anxiety, 3% with OCD. We know that OCD isn't new. OCD is one of the most chronic and prevalent mental health conditions in the world. It's one of the top 10 reasons people file for disability globally. It costs the US economy like upwards of $8 billion a year in lost productivity, and it is a chronic major mental health condition. And I think that I always like to start with those statistics, because I think a lot of times, right, society doesn't understand OCD for what it is. And unfortunately, I would say one of the negative impacts of COVID during this time has been this kind of increased stigma and stereotypes of OCD, of, oh, now I have OCD because of the cleaning I'm having to do, or, oh, this is what it's like to live with OCD. When the reality is that it's not what it's like to live with OCD. Yes, you have to now follow rules you might not have had to follow, or you're washing or cleaning or doing things you've never done before. However, you're often washing or cleaning or following the guidance of CDC, and you feel like it's complete and it's done, even though it might feel annoying or frustrated, compared to someone with OCD. No matter how much cleaning, how many rituals they do, they don't get the feeling that it's complete. They don't get the feeling that it's done, and that anxiety persists even after the rituals or behaviors. And I think that's really important for us to make sure we think about.
But although if you think about following the guidelines, there are a lot of similarities where it really is never enough, and you never get that seal of approval that, yep, I put in the work and now I'm done. I know for sure that every surface and so there's a lot of similar, not in people jokingly saying I feel so OCD, but really in that sense of tolerating uncertainty and just you have to do good enough and eventually choose how to live your life. So it's been yeah. Yes.
Yeah, and I think, and I think what you're speaking to is also what those of us as providers can see the real similarity, right? And I think that if we can hone in on that of like, yeah, but even when you follow CDC guidelines, you're not totally sure if you trust them, right? You're not sure if it feels like it's enough. That's how someone with OCD feels. And I think that's critical to discuss. But I think oftentimes the stereotype from society is that like, oh, cleaning, right? Or just, but you're right, that prolonged distress and the discomfort and the anxiety and uncertainty that people are experiencing because of COVID and because we really don't know that much about it, that is exactly what it feels like to live with OCD.
Right.
So the reality is that despite knowing this and despite knowing how chronic and prevalent OCD is, we also know that there's hope and help, right? We know that anxiety and OCD are treatable conditions. We know that ERP is one of the most effective mental health conditions that exists. It has amazing efficacy rates. And we know that people with OCD and anxiety can live meaningful, successful lives despite their anxiety and their symptoms. And that includes even if for the first time COVID's kind of setting them over the limit, or they're feeling overwhelmed or exhausted, we can still get them on track, just like we can if someone's been living with OCD or anxiety for many, many years. So what has happened, and I think Dr. Kissin, this is what we were just speaking about, is that what's happened is that we've seen people who never had a diagnosed anxiety disorder talk about feeling completely overwhelmed right now, and talk about feeling this level of uncertainty that they can't accept, right? It being so difficult and so daunting. I have a couple close friends who over the past 3 to 4 months, I have always known they have anxiety, and I've always even given them some tips on anxiety, but this has been a turning point for them where they've really started to say, wow, like my ability to tolerate this and to tolerate these feelings isn't really there. Would you say you're seeing similar things?
Well, I think the illusion of control has been lifted every time we get in the car to assume we're going to be safe, and every time we separate from our family to feel that in fact we have control and life is certain, and to get through our days, our mind likes to live in that space, but then there are the moments of really making contact with the lack of control and the uncertainty that's built into our existence. And I think COVID's really brought that forth in an undeniable way for even those who felt like, yeah, I got this and I am the master of my universe. Like, so it's hard to not accept the uncertainty that we all are. It's part of existence, the human existence.
Yeah, and I think that's what, that's really what people without OCD, but with new or onset anxiety are learning, right? Is that, oh, I have to start to accept this level of control that doesn't actually exist, right? Our previous level of control didn't necessarily exist either, but we believed it did. And we lived in a world where most people lived in a world where it was okay to believe it did, because that wasn't really challenged on a daily basis. And I think with COVID and the anxiety we're feeling around it, the uncertainty that it places on your children's school, your job, your ability to go to church, to go to the movie theater, to do things that were normal.
Everything.
Yeah, that were comforting, right? That like it was your life. It's been totally different. And a lot of people are struggling with how to deal with that. And I think in addition, right, when we are OCD providers, the thing that we are always talking about is don't avoid people, places, and things. Don't isolate. Make sure that you continue to push yourself even when it feels difficult or challenging or even unsafe, right? That's what we're telling our OCD patients. But here we are living in a world where isolation is encouraged, avoidance of people, places, and things are encouraged, and we're telling people like use your best judgment, and really that means like actually go beyond what you think is safe versus taking any risks at all, because right now it can be dangerous, right? And no one knows the risks, so it's like better to be safe than sorry when it comes to COVID. But I also wonder what you're seeing and like how you're seeing this manifest for people with the OCD, not as much around OCD symptoms, but just the general notion of start doing things you've been encouraged not to do in treatment, right? Of avoidance and isolation.
Well, I guess I think there's always that growth opportunity if we're creative enough. There's always that way we could put ourselves in just enough discomfort to expand our world and learn and grow and live. And so whether that's working with a client on maybe joining an online meetup and to make some new relationships, or maybe finding an outside activity to meet some people and volunteer, or maybe taking a course professionally that feels intimidating. There's always a step forward. We don't always have to face every one of our fears, but there's something that we could do each day to grow. We just get a little more creative these days, I think.
Exactly, right? And I think that reality is that sure, the easy kind of way to stay safe is to isolate or avoid, but the reality is that we know the impact that can have on mental health. And so while we have to be creative and it's not the norm, right? The way we connect right now, the way we talk to people, the way we live and function and breathe, it's different, it's creative, it's innovative for all of us. It can still happen, and it's really critical that we continue to find ways for it to happen.
Mm-hmm.
And so one of the things we'll talk about that I think is really important is us really thinking through how patients with OCD in particular are going to navigate the new normal, right? I know here at our clinic at McLean in Houston, we've never had sanitation stations that include hand sanitizer all around our campus. We've never encouraged hand washing or told people you have to sanitize or hand wash every time you come in.
I'm sitting here right now I have a bunch of supplies to bring into my office that, like, my daughter just came back from like a little camp with a babysitter, and they made tie-dye masks. Like,
yeah. But like,
this is what we're doing.
Well, and my thing is like, when did we ever think we'd be treating OCD and encouraging these things, right? This feels so foreign that we're encouraging, again, our patients here, right? You can't go out, you can't, you're isolated in our clinic because we can't potentially risk outings where people would have encounters with COVID, and you've got a hand wash, and have you sanitized, and let me check your temp twice a day. And so for patients with health anxiety, for patients with contamination OCD, there's a lot of extra anxiety right now, not just around COVID, but one of the things I keep hearing in the different events and webinars I'm doing from the OCD community is I'm scared to follow the guidelines, and I'm scared to do what people are telling me to do because it has been a hallmark part of my treatment.
Right. I'm scared of going back to the depths of OCD hell. Like, that is terrifying. Yeah.
Terrifying. And what we're learning, and we know this, but what we're learning by seeing is that isn't the case, right? We know, again, and John talked about this in the webinar that he did as well, we know that while it feels like, giving into a hand wash or hand sanitizer, that could become a ritual that then can catapult me to falling back into all these OCD symptoms that I've given up. What we know is that you're not doing it for OCD purposes.
Right.
You're doing it for COVID purposes. And it's really important that we differentiate that we're not talking about a OCD hand wash that's 2 hours in front of the sink and you're not able to leave because you don't feel complete. We're talking about when you've had encounters that would put you potentially at risk of contracting COVID, that you engage in a 20-second hand wash with soap and water, and that's it. And that is still going to be triggering if you have contamination OCD. It is not going to feel complete. And I think it's just really important we help individuals and clinicians understand that we don't need to be scared about recommending that people follow guidelines. That's what we should be doing. But it's about differentiating a guideline from an OCD rule.
And also for individuals to know, their wise mind knows, and they might not, it might feel scary to think, I don't know the difference. What if I'm washing my hands and I get swept up in the compulsion? But like you have so much strength and knowledge, and like your mind knows when it's doing something because it's values-based living. Like if you touched 2 years ago, if you touched chemicals and then, well, I know if if you, yeah, like if all of a sudden like you fell into a pile of chemicals before you ate, you would wash your hands. It would make sense. You've always, there's certain things that you just did in order to live. And so it's clear when it's those behaviors. It can look the same, but it's the function of those behaviors. It's going to feel different, and it's going to have that urgency and that OCD feeling versus this is something I'm doing because it's the right healthy move to make. So right now.
Right now. Okay, exactly.
Yeah.
And I think that the second piece to this slide is that, we know anxiety, fear, panic, those things can set in at any time. We know that we're often trying to avoid that. And we know that, isolation can create it, but hey, so can exposure, so can ERP. And how can we meet in the middle, right? How can we follow guidelines but still engage in treatment so that anxiety, fear, panic, all these things that could be a part of COVID, could be a part of our diagnosis of anxiety or OCD or depression, don't come back up and don't have control if they previously did. And what's important for us to notice, and I think because a lot of people will hear this, is like, well, we'll just wait for treatment because, treatment for contamination OCD isn't going to work right now. Yes, it will. It is very, very different and actually quite simple eventually as a patient for you to differentiate between an OCD thought versus CDC guidelines, right? And it feels intermeshed, but it's really not. And we can differentiate between what's safe versus what's OCD. And once you're able to do that, then we can work on OCD the same way we always would.
And just one thought that I had about the fear of, if I do this behavior that feels so similar to the compulsions I work so hard to move past, there's also sometimes OCD about OCD. Sometimes it's the final phase of progress past OCD where you're really past your immediate symptoms around obsessions and compulsions, but then it's sort of this fear of, oh no, it's this fear of reverting back. And it's always been about the fear of fear and the fear of the discomfort anyway. So there's something also to challenge and work on around, no, you're stronger, that no one can take you back there because you naturally, you're at a different point. You can't go back even if you want to go back. So yeah.
And knowing that, actually, I think engaging in CDC guidelines, even though it might feel like, oh, could this be a ritual? That's a great exposure in and of itself, right?
Right.
And you find that when you're doing a 20-second hand wash, which is recommended by CDC after being in public or touching shared space or something, or whatever the guidelines are, and you find that it's hard to walk away after 20 seconds, or now it's triggering intrusive thoughts or the urge to continue ritualizing, that's also wonderful information for you about places that you can still work on for your OCD, right? About ways that you can still engage in ERP and treatment, because it is still maybe something that's there, but that you've avoided. But avoidance of it overall isn't going to help anything, right? So if we just avoid going out because we don't want to have to hand wash because then we're worried that would be a ritual, now we're creating so much fear around the potential that OCD can come back up, that again, that, as you mentioned, will become another intrusive thought or trigger or worry. So we want to address that as well. So when we think about returning to life, it's different for all of us. I know you, Dr. Kissen, are in Chicago. I'm here in Houston, which has been crazy the past couple weeks. And we're all trying to navigate what life looks like moving forward. We reopened our residential program on June 1, and I've been back in the office here since mid-May. And a lot of my friends are still not doing this, right? They're not returning to work yet, and they don't even have a return to work date. And for a lot of us, there's this immense amount of anxiety and uncertainty because there's no standard, right? Everyone right now is experiencing different dates that they're going to return to work, different information about whether their kids are going back to school, different rules around whether summer camp's going to happen or not, right? And it's about us kind of figuring out despite uncertainty, despite us not knowing what tomorrow holds right now with coronavirus, we can still live a successful, meaningful life. And as we start returning to life, and for those of us, for people who don't have OCD or anxiety, what they may find is that things kind of just go back to normal, and that they're able to kind of just revert to old behaviors, old patterns, and they kind of go back to normal as they can. Obviously, it'll be a phased approach because none of us are pretending like COVID doesn't exist tomorrow. But for those with OCD and anxiety, we may not see that same ability, right? Especially if this has triggered new onset OCD or anxiety symptoms, or even past symptoms. What we may see is that as others start to just go back to normal and COVID starts to decrease, people with OCD, their symptoms may continue to increase while COVID decreases, versus the opposite way around, which is just, oh, well, COVID's not here anymore, so why are you still worried about it? Or this isn't something we should really be worried about. Like, people are going back on planes. Why aren't you going back on a plane? Why does that scare you if other people are doing it? And I think it's really important we just spend a second to unpack that and to think about and talk about some acceptance-based models of expectations for yourself and your loved ones, or even your patients, and how we can help people navigate that when that comes up.
Mm-hmm.
So,
yeah, I'm just thinking, I've, as well as I think overall, just really been so impressed with all of my clients and individuals that have really how all of humanity is moving through, and how adaptive really everyone's been so impressive. I'm seeing this sort of reopening anxiety in terms of, okay, I got used to certain rules. Okay, I got used to, we wiped down certain things, but now some people are doing that less. And so there's just the rules are shifting, and so we quickly adapt to something new, and then all of a sudden when that shifts, it's like, well now I'm leaving a bubble that I have created that felt somewhat safe. And so I'm definitely seeing some anxiety around that.
well, and I think in particular, what we see too is that for people with OCD, this rigidity in being able to shift with the rules, right? If you haven't done
Right.
your treatment yet, and you haven't done ERP and exposure-based and CBT-based work, your ability to tolerate the anxiety and shifting isn't the way other people's would who've been through treatment. And so I think when we talk about patients who've been through treatment, I agree, right? There's this level of just resilience, but ability to teach, and for society to learn from them, and to learn from how they manage anxiety and how they lean in. But for those who haven't had treatment, right, and aren't comfortable leaning in, when they've engaged in rituals or avoidance for OCD behaviors, and now it's focused on COVID, when COVID is starting to decrease or people are returning to life, but their OCD symptoms aren't changing, or their fears aren't going away, sometimes the people around them don't know how to support that, because it's like, well, you shouldn't be worried about that anymore. Like, they said that you don't need to do that one behavior, like, or, but then also, how can you trust, right? We hear this a lot of like, well, how can I trust CDC? Because they keep changing what they say, or they keep changing the rules or guidelines. And it's true, right? I think in general, most people right now would say, like, I don't know how much I can trust CDC, or I don't know how much I can trust the World Health Organization when it comes to guidelines, because they shift. And we know that as you learn more about COVID, guidelines and rules and recommendations are going to shift. As we start to reopen, we're going to learn more, and things will start to shift. But the ability to be flexible in that often is also an indicator of your ability to tolerate distress. And done the work, and you're not in this place where I can't tolerate anxiety, but instead I kind of welcome it, and it just is par for the course, but I know it'll subside.
And I think in popular media, and we talk a lot, you hear a lot about resiliency, and resiliency, maybe that's the silver lining, and our kids will hopefully be more resilient. And there's something very true to that flexibility, because there's one thing that we can guarantee in life, is that there's going to be tons of uncertainty and tons of change. This happens to be an unusual, like the Olympics of change and uncertainty. So hopefully in our lifetime, we won't all have it jam-packed so much in such a short amount of time, but that skill of adapting and evolving, leaning into the unknown is something like we're all going to be stronger for. Not to be so helpful, you know, it can be annoying sometimes, but we are growing through this.
Yeah, and I think, you know, what you and I have continued to mention about patients with OCD and seeing their ability to actually tolerate something like COVID even more than the general public,
Mm-hmm.
indicator that when you've done this work, it pays off in the long run, right?
Mm-hmm.
And so if hopefully all of society and this
Yeah.
generation can learn from this and be more resilient, and imagine, right, how amazing that would be. So when we think about how treatment has changed versus stayed the same, I think really it hasn't. And I think that, you know, as you and I were just talking, the way our treatment facilities look different, right?
Right.
You know,
Right.
I've got hand sanitizer and masks, and we're doing treatment with masks on, and we're not touching
Mm-hmm.
each other, and we're not doing the same exposures we would do. We're not doing public exposures right now, which
Right.
is part of our treatment with patients. And so
Mm-hmm.
certainly treatment has changed as far as how it looks from the
Right.
out. But when you think about the components of OCD and anxiety treatment, and when you think about what we're trying to gain, right? We're not trying to teach people to never have anxiety. We're not trying to teach people that OCD just, you know, just don't worry about it and never address it. We're teaching you skills about tolerating anxiety. It's about leaning into it. It's about accepting uncertainty, and it's about knowing that you're going to have triggers in the future, but guess what? You also are going to now have the tools to deal with them. And you're going to know how to, the difference between being able to engage in appropriate ERP versus ritualizing, and the cycle and the outcomes that one versus the other would have. And so I think that I've heard a lot of clinicians really talk about their concerns, right? Should I have hand sanitizer in my building, or does that reinforce rituals? Should we encourage patients, like if they want to do an exposure that we don't feel, you know, as comfortable doing, what should we do? How do we tolerate that right now? And I think the reality is we have to use our best clinical judgment, you know, but I think
And
that
that's clinicians, I think we're all human. So that's, I would, examples of clinicians really wanting certainty where there's not certainty. And so we all are going to cling to like, what are the rules? What's okay? And your clinicians are going to be, we're all in the same, we're all in it together. So those feel like examples to me of really just wanting to know like what is the right way, definite way we should be doing this.
yeah, and the answer is there might not be one, right? But at the same time, use your best judgment and you follow guidelines, right? Nobody right now is going to say with an OCD patient, let's go do public exposures at Target and touch everything and not hand
Right.
wash and eat a meal. Like,
Right.
yeah, we could have done that 6 months ago, no problem,
Right.
right?
Right.
Even a standard part of treatment. But the way treatment has changed is the fact that guidelines are now in place we need to follow. But the principles of treatment, the components haven't. And so again, this is where I just want to always remind and push clinicians and individuals with OCD that while the exposure in and of itself might look different, the ability to lean in and experience anxiety and lean into uncertainty hasn't changed. And again, following CDC guidelines is not following OCD guidelines. And those are very different things.
Mm-hmm.
So I think that's really what today's about. And I think it's about us speaking and talking to the fact that OCD patients are resilient. And we've seen and learned so much from people with OCD and anxiety who've done their work. And they've been their parents, their loved ones, their friends about leaning in, about accepting uncertainty. And while the transition to normal life for people with or without anxiety or OCD is going to be difficult, we may find it even more challenging for people with OCD, in particular if they haven't done their work. However, we still know that despite COVID and despite everything going on, treatment works, and treatment works really well, even virtually. And so there's wonderful opportunities for people to hone in, gain the skills that they need to have so they can have success in their treatment, even during a time like this.
Mm-hmm. I'm inspired.
Thank you. And
Yes.
so questions or thoughts that you have or want to touch base on?
That's my thinking face. And what is a recent, I was thinking just a moment ago of a recent exposure. So any contamination, OCD exposures. Like, for example, I have a client that I'm working with who was trying to kind of demanding rules of those in her environment that was creating a lot of family stress and tension. And the more stress and tension is certainly not helping anybody. It's not helping family dynamics, especially when we're all kind of stuck at home together. So maybe like demanding that or requiring that, like when people leave the house, when they come home, wipe down their keys, wipe down their phone. So maybe certain steps that she felt was appropriate for her, and but was demanding it of her family. So I would consider that more response prevention around the compulsion of trying to control those around her beyond the basics. Like, of course, it's reasonable to ask those around you to, at this point, wash your hands when you get home. Fine. So what are some exposures that you've done of late?
Yeah, and I think as far as that goes, I think one of the things I would always lean into is like, you can also have your rules, but it's also a great exposure to trust family that they're making the best decisions as well, right? So instead of even demanding a hand wash, how about you just trust that they're taking precautions that they feel need to be taken, and you let that go, right? Versus still having any sort of rigidity and requirements, because again, doubtful that OCD is ever going to be truly appeased with it. But as far as contamination exposures, I mean, we do them all the time, every day, even here, right? So some of our patients, now it looks different, right? But some of our patients might have contamination exposures that for them, they're really triggered about touching something and then eating or cooking. Now, previously, we might have intentionally had them cook for everybody while they're feeling contaminated. Something like that may not be what we're doing as much of because of COVID, even though we're not worried about COVID with this contamination. It's another OCD contamination, right? Of whatever bloodborne illnesses or whatever the fears might be. And so I think contamination exposures have stayed pretty traditional for us, minus being able to do public stuff. So patients are still sitting on the floor with us and cross-contaminating and touching items to them that used to be contaminated and cross-contaminating it with their other items. Because again, most of their contamination isn't COVID-based, it's general contamination-based, that they can still find ways to do exposures.
Yeah, we've also done lots of imaginal exposures around responsibility for harm. There's a lot of that coming up if I'm the one that spreads COVID to, and the shame that could be associated with that, and the responsibility for harm, and also just a lot of the health anxiety around what it would feel like to just pressure in lungs. So I mean, there's always opportunities to play with anxiety, and that just means kind of that it's that rigidness, things have to be this way, versus like, how do we just maneuver a little bit in a more light way through it. So it's great. I'm glad to hear that you guys are doing it in person, that you're available. And so for all the attendees, we have the information for the OCD Institute, the McLean OCD Institute, and you could also go to ADAA.org and get some additional information. And this was a super helpful conversation. So hopefully maybe we could have one again, maybe in a month or so, and hopefully we'll be at even a new phase of transitioning through COVID.
Yes, I sure hope so, and I hope it's a phase forward. So
yes, that's true. When I said new, I was thinking that, but that's true.
Yes, absolutely. So thank you guys for having me, and I think that the reality is that treatment does look a little bit different from the outside, but the components and fundamentals haven't changed, and they still work, and people can still experience amazing success even during this time, where I've heard a lot of people say, like, I'm nervous to start treatment right now because I don't know how successful it will be. And I can tell you, my patients here are simultaneously saying, like, thank you for being open. This is making a difference in my life. So we know it works.
Right. And I have a lot of clients or individuals coming to us from, like, this is a really great opportunity to do an intensive. Consider maybe you could go once a week, twice a week, but if we could get in 4 sessions a week, why not rip the Band-Aid off more quickly? Because your work is slowing down, and you have a little bit. So it's kind of a gift you could give yourself. You're okay, and we could do this, but why not really go for it and in a more expedited rate, because we have a little bit more time these days to do things that maybe we wouldn't have had. So
100%. And I think the ability or flexibility for all of us to have to learn virtual quickly and to be comfortable doing teletherapy if you weren't already doing it has been such a blessing, especially for the OCD community, because you're really getting home visits at your with your provider is something that's pretty rare to be able to get frequently. And we've seen, like, a lot of people have talked about decreases in no-shows or late appointments because it's so much easier, right? You're at home, you just log in. And
right, it's harder to complain about traffic unless it's
Exactly. So treatment works, and thank you guys for having me, and I look forward to doing one again soon.
Oh, thank you so much. So good to see you.